Hello and welcome to this BioProcess International Ask the Expert webcast. I'm your host, Alex Nicolaitis, the webcast coordinator for BioProcess International. Before we get started, just a couple of notes. This webcast is being recorded and will be made available for replay in the multimedia section of our website. We have muted our audio lines, but we welcome you to type in your questions for our speaker in the Q&A window on your screen. After the presentation, we will begin the question and answer portion, and now we'll ask our speaker your questions. Your questions in the Q&A window will only be visible to myself and our speaker. So thank you for joining us today. It is now my pleasure to introduce our speaker, Yulia McHead, Product Manager, Biostat RM Bioreactors from Sartorius.
Hello, everyone. Thank you so much for joining our presentation today. I'm very excited to present to you a flexible intensified C-train concept offered by Sartorius that we believe will boost biopharma productivity. So here are a few items that I would like to discuss with you today. The first question that is probably on everybody's mind is why to intensify? And the 5 advantages that we see in Sartorius that are integral part of process intensification. After that, I will touch base on the intensified modular C-train concepts, followed by the customer case study presenting certain intensification results that we were able to achieve with Sartorius equipment. And after that, I would like to wrap up today's talk with conclusions. Okay, so without further ado, let's discuss why intensification is important and which advantages this process might come with. Over here, we identified 5 pillars that are associated with process intensification. So overall, we see these major business drivers as first one being the lowered cost of goods. So we know from our customers that are already using process intensification that they were able to achieve even 30% reduction in the overall cost of goods. The second pillar that is listed here is the reduced footprint. Some of the field reports were getting back data to us that our customers were able to achieve reduction of the footprint even by 70%. The third aspect of the process intensification are the shortened timelines. Overall, we were able to collect data that would confirm the faster build-out time for majority of facilities, and the overall number would be less than in 2 years. The fourth business driver that we identified is increased productivity. Overall, the process intensification can boost the overall yields sometimes by 2 to 3 times. And the last business driver that we selected here is the increased flexibility. In general, various molecules then can be manufactured in the same facility, and not only that, but also with the same equipment. Within the Sartorius, we offer a very broad scale of bioprocess solutions. Either that would be at the process development level, where our Ember bioreactors are playing a pivotal role, or later on in the upstream production, for example, with the Biostat RM or Biostat STR, when paired together with various analytical and automation services like BioPath Toolbox or data analytics software, as well as the SCADA system, for example, BioPath MFCS4. Overall, Sartorius offers then a tailored solution for all types of customers, either working on the process development stage or at commercial manufacturing level. Today, I would like to focus a little bit more on the C-train bioreactors, specifically the Biostat RM and Biostat STR. So we are moving now forward, and now I would like to discuss a little bit more the concepts of the intensified modular C-trains. If I were to have you one single sentence kept in your mind after listening to this presentation, I want you to remember that modular C-train provides a faster time to market, increases productivity, and offers full flexibility. So how did we come to this proposal? Well, the integral component of any product development project at Sartorius is the strong cooperation with our customers. In very tight collaborations, we would discuss that what are the current needs that our customers would have, what are the driving forces for them at this point of time. And probably one of the major concepts that we were able to identify is that our customers are routinely facing increased time pressure to bring new molecules to the market. And probably the best example here would be then COVID-19 vaccine. On top of that, we know that the population of the world is increasing, and thus there is an outstanding demand for higher product yields. No matter what the yields are, they also need to fulfill the increasing demands of the stringent regulatory environment. Another concept that we were observing lately in the field that our big pharmaceutical customers tend to outsource production to somewhat smaller CMO or CDMO partners that will later on have multiple molecules in their pipeline. Thus would require the equipment to be more flexible to accommodate these versatile molecules. And probably the last one here is those primordial beasts available in the market, is that whenever the processes are being transferred from the PD to CM scale, they tend to be prone to mistakes that would then require a lot of time and effort to mitigate. So when we were thinking, how can we address these customer pain points, together with my colleagues, we identified these three major concepts. So the first one is the off-the-shelf automation that can be shared between multiple instruments, that is also supported by the latest industrial norms and standards, would help reduce human errors and then risks that also have a direct influence on the time to market. The second concept is, of course, the process intensification that has an unprecedented result on the overall product yield. And the third concept is the modular equipment concept that then provides very flexible workflows that customers can accommodate depending on that particular molecule that they have currently in the pipeline. So tying up these two sections that I presented to you today would be then our product proposal, which is a flexible modular C-Train solution that is powered by the BioBrain automation platform. The C-Train offering from Sartorius consists of two components. The first one is the first-in-class wave-mix bioreactor system that now fulfills commercial manufacturing norms and is suitable for use in clean room environment. And the second player in this proposal is the Biostat STR Generation 3 bioreactor that comes with multiple organizational solutions. Here, I would like to present to you today two concepts of the C-Train. The first one would be the classical fed batch, and the second one is the Intensified RM200 N-1 C-Train. If we look at the classical proposal, it usually consists of 4 N-X stages, then followed with the production bioreactor at multiple scales. But here we are presenting to you a production bioreactor with a 2,000-liter volume. This C-Train concept is usually associated with the multiple equipment bioreactors, so multiple equipment items, and usually lasts 24 to 31 days, but it of course depends on the particular process in mind. Intensified offering, as you can see, is drastically different to our classical proposal, and it consists of relatively smaller number of equipment. So at this point, only 2 N-X stages, followed with the production bioreactor. It is also associated with the lower consumable costs, as the N-1 or even N-2 stages can be already used in the perfusion mode with the bags that have integrated perfusion membranes. So thus, they don't require an external cell retention device. And additionally, the C-Train lasts relatively shorter compared to the classical scenario. Over here, we also offer another proposal where only the N-1 stage can be used in the perfusion mode, whereas the N-3 and N-2 stages can be still used in the batch scenario. With intensification of even one step of the C train, we can already see a positive effect on the process duration and overall costs that are associated with the C train. So even smaller production bioreactors, for example, in 1,000 liter scale, can be already directly inoculated with the cells that were grown in the Biostat RM200 bioreactor. An important point here to make is that RM bioreactors are specifically tailored for the shear stress sensitive cell lines. So why choose an intensified C train? So first of all, it's a minimal hardware investment that would eventually reduce the capex. The C train is then associated with a lower footprint, so less equipment, less steps, and have been known to have a substantially increased facility output. Some of our customers were reporting even up to additional 6 batches per year. So if we were to compare numbers to numbers, apples to apples, you can see here that numbers-wise, the third batch C train is relatively longer, has more steps, more equipment, is more costly, though it is tailored for customers that work with proven technologies and do not want to deviate from the golden standard of the field. Whereas the intensified RM200 N-1 C train has less days or is associated with a lower number of days, a smaller number of steps, requires less equipment, and is more budget friendly. So it is predominantly targeting our more cost-conscious customers, for example, smaller CMOs or CDMOs, or those companies that have less demanding C trains. Nevertheless, even buying the classical C train equipment that can be already in the perfusion-ready format then prepares you for the future changes in the process, meaning that the intensification can be then implemented at the later process development stage. Now I would like to present to you the results of our cooperation with the company Intas. So our client, company Intas, reached out to us when they wanted to optimize their 4,000 liter production, and they required fewer process transfer steps without changing the feeding strategy. And overall, the goal of this intensification exercise was to reach at least 50 million cells per ml and at least 95% cell viability in N-1 perfusion. Our incoming data that we had to operate with was that the customer was running a standard fed batch process, had 5 transfer stages, starting from the shake flask, then continuing into the rocking motion bioreactor, then steer tank bioreactor, and finishing with a 4,000 liter production steer tank bioreactor. Overall, cell concentrations were 7 to 8 millions, and the viability was 95% in 14 to 16 days fed batch culture. So what we proposed? We proposed to intensify the Biostat RM50, and that would eventually result in the decreased number of C-train bioreactors. Here you can see the summary of the incoming data on the top, so where we had 4 stages in the N-X, finishing with a production bioreactor of 4,000 liter, and the lower section describes our proposal. So the customer was still working as a N-2 stage with a shaking flask, then continuing into the Biostat RM50 liter in the perfusion mode. That would be then inoculating the production bioreactor in 4,000 liter. We were able to achieve the viable cell concentrations of 50 to 150 million cells per ml, and cell viability was 98 to 99% in 6 to 8 days process. We are also showing a very comparable growth kinetic and yield compared to the control process or the incoming data that we had. So overall, our customer was able to save time and costs that were associated with the 2 additional stages of the C train. We also were able to confirm that overall cell culture productivity was increased approximately by 10-fold in a substantially smaller manufacturing footprint. So, and with this, I would like to conclude. Why should our customers then use the Biostat STR and Biostat RM for the intensified modular C train? So first of all, the C trains are associated with the lower cost of goods, as I was mentioned before. For example, the flexible RM system can then offer cultivation from 100 milliliter and up to 100 liter working volume. And we also have lower initial capex due to the decreased number of bioreactors necessary. We also see a reduced footprint associated with the same point as the reduced initial capex. Our customers report back shorter timelines. It's also associated with a lower number of equipment that would then eventually require less qualification time. There is a definite productivity gain as our Biostat STR and RM bioreactors have validated offerings for higher cell densities in N-1 stage. Also, we offer one production C train that is suitable for both classical fed batch and intensified processes that adds this extra degree of flexibility. With this, thank you so much for your attention, and we are open for the Q&A session.
Okay, great. Thank you. So our first question is your automation system GMP ready?
Yes, our automation platform, or BioBrain, that's the name of it, is GMP ready and offers our customers user management, password management, audit trail, batch reporting, so everything that is necessary in the GMP field.
Okay, great. Our next question, do you offer control based on viable cell density?
I think I will pass this question to my colleague, Matt Hauser.
Yes, hi, I'm Matt Hauser. I'm the product manager for the Biostat STR. Yes, we do offer a control based off of our BioPet Biomass, which is a viable cell density measurement system. This is available in a single-use implementation. So we have this integrated as a single-use probe directly into the single-use bags. And the BioBrain automation system that Yulia described includes control systems, control loops operated off of the viable cell density measurement so that you can automate things like a cell bleed or cell feed or viable cell density based bleed and feed functionalities as part of a perfusion process.
Okay, great. It looks like we have time for just one more question. So if we didn't get to your questions today, we will be passing them along to for our speakers to answer. So our final question is, what cell densities do you achieve in RM and STR?
Okay, so I will take then the RM part. So we have reports of achieving up to 170 million cells per ml in the smaller RM bags. So for example, 2-liter perfusion bags, and somewhat lower, like for example, 100 million cells per ml in our bigger bags. So like 20-liter or 50-liter bags.
And then in the Biostat STR, we have similar results. So we see the 50-liter, 200-liter, and 500-liter. We have some reports, published reports, getting as high as 190 to 200 million cells per ml. Typically, it's probably a little bit less than that. Maybe about 150 or so is a realistic, achievable number in the Biostat STR.
Okay, great. So thank you to Yulia and Matt. And thank you to our audience for joining us. The recorded version of this webcast will be available for on-demand viewing on our website. And as a registered attendee, you will receive a follow-up email providing you with a direct link. We look forward to having you join us at future BioProcess International Ask the Expert webcasts. Look for those announcements in your inbox. Goodbye.